cookies, we have hot cocoa, we have coffee, and we have condoms. So they're all free for you. So they're over there. We have condoms and lots of different information in the back for you. That, you know, if you have questions or there's websites on there. So Emily is going to be talking to us today about several different things. So if you are not interested in at least, you know, just kind of paying attention on the peripheral, we just ask that you stay quiet. Gentlemen over there, my gamer friends, because we are zooming this into our other campus. So we do want to make sure that our friends in Pocono can hear us. So grab hot cocoa, cookies, coffee, condoms, and then I'm going to let Emily take it away, okay? Yeah. Yeah. And then you can let me know if there's
Hi, everyone. Thank you so much for having me back. This is my second time actually doing a presentation like this with Northampton Community College. The last time was at your Tannersville campus, so I'm excited to spread my wings down to your Bethlehem campus. Thank you again. It was really fun last time. I hope you get something out of this today, if nothing more than hot chocolate or a condom. That's also good too. As she said, my name is Emily. I am a physician assistant. Although if you see a PA or know a PA, the term actually changed in 2021. It's physician associate. I'm just an OG and I haven't changed how I say it yet. So either way is fine. Physician assistant, physician associate, either one, no one's going to really correct you. I have been practicing in the Lehigh Valley for the last 14 years, 13 of which I have been practicing in women's health. And the last 3 years I've been doing telehealth in a sexual health institute for an online company, which has been really fun and different. My previous jobs were just women's health at both St. Luke's and Lehigh Valley. So this has been a cool thing for me to provide more gender inclusive care in the role that I'm currently in. Before we get started, I just want to say we're going to talk about some things today that I don't really want to say like trigger warning, but if you or someone you know has ever been a victim of sexual assault or something along those lines, those are some things we're going to talk about. We're going to talk about, most importantly though, keeping yourself safe and knowing how to advocate for yourself. So knowledge is power in these situations. Just letting you know, we are going to talk about some sensitive topics. I also am going to pause throughout. If you want to stop, raise your hand, ask a question, clarify something we just said, or just something you've wondered about, please feel free. All right, first question. How do I?
Yeah, keep going. They're not going.
Snap. Hey, maybe. Hold on. Stop.
I'll point it over there. There you go.
Okay. So, and if you don't want to yell it out, that's okay too. If a person says yes, later changes their mind, they are no longer giving you consent. Yes, correct. So I feel like we're going to talk about this obviously with what consent actually is, but this is a common misconception that if someone says yes to something, that covers the entire sexual experience, when that is absolutely not the case. I see there's so many things. Oh, that's okay. Maybe. Oh, hey, so it seems like this thing is really tricky. Okay, so consent in really simple terms is the agreement that you're giving willfully without any external pressure factors in order for someone to consent to sexual activity. Both participants must be continuously communicating, and that means before, during, and after any sexual activity. Doesn't always have to be verbal. Discussing boundaries, expectations, and consent between participants at every sexual encounter is the best way to avoid confusion. I think a common misconception is also that consent is always verbal, and that is absolutely not the case. It doesn't have to be verbal. So we know it's much, much more complicated. Sorry. So consent must be freely given, meaning this is given voluntarily and without any coercion, which we're going to talk about in a second. External factors, pressures, threats of physical violence invalidate any type of yes or no that may have been given. Clearly, while sober, we're going to talk about that a little bit too. Someone who has had too much to drink or isn't under any influence of anything cannot consent to sexual activity. I feel like this shouldn't need to be said, but certainly happens. If someone is unconscious or sleeping, they cannot consent to sexual activity. It has to be given continuously and with every sexual act. Just because someone consented to sexual activity 100 times doesn't mean you have consent for the 101st time. It has to be given every single time and can be taken back. Like we said, you must stop sexual activity if someone tells you they are not consenting going forward. And with awareness. So if you or a partner is reluctant to continue sexual activity, and you're not aware of what the person is planning to do next, that is not consenting. So I really like, well, I'm obsessed with Planned Parenthood. They're just wonderful, and they provide so many great services. They have a really great way to remember this if you're just like, what the heck did that lady talk about today? FRIES is a really great way to remember what this stands for. So it's freely given, it's reversible at any time, it's informed, so both parties are understanding what's happening, what the other person wants. Enthusiastic, so you're not being pressured into something, this is something you want to do. And specific, so both parties know what the other person is expecting and what may happen next. I think a really great example and something I run into with patients is like saying somebody wants to hook up, or oh, I just want to, be hooked up. That can mean 10 different things if you ask 10 different people. So just that example of like, what do you mean you want to hook up? What are we going to do when we hook up? What does hook up mean to you? Like, that's a great conversation to have before anything takes the next step. And that is something that I hear over and over again, or, well, I just thought he wanted to hook up. I just thought she wanted to hook up. And then it ended up going too far or into a place that made someone feel uncomfortable. So having those discussions beforehand and consenting, super, super important. So, most common date rape drug. What do we think it is? So, commonly referred to as roofies, Rohypnol, ecstasy, or alcohol. What do we think? Yeah. It is so alcohol. Definitely alcohol. And definitely among college students, it's definitely alcohol. I feel like if you watch movies, if you watch Law and Order, it's always like, oh, she was roofied. And not to say that doesn't happen. Of course that happens. But we think it has to be like a drug. Like alcohol is a drug, and alcohol is many times used by those looking to commit an act of sexual violence. So a recent study showed 75% of perpetrators said they got their victim drunk in order to take advantage of them sexually. So ways they can kind of go about this is they kind of target someone who looks like they're maybe drinking too much. They might bring you a drink that is hard to tell if there's a lot of alcohol in it. Like, I don't know about you, I've had like fruity drinks in the past where I'm like, this is delicious. And I've had one and be like, oh my God. So knowing that there are drinks out there where it's hard to taste the alcohol, if someone's trying to give you those types of drinks and buying them for you, red flags should be going up. And we also know that some perpetrators specifically look for individuals who are drunk and therefore vulnerable. So something to keep in mind while consuming alcohol. So this is a big one. So sexual coercion. So there's sexual consent, and then there's sexual coercion, which is where consent Is it being freely given and someone's trying to pressure you? And this is kind of like where the red flag should start going off if you hear some of these things. And not to shame the other party here. Sometimes people don't even know that they are being the sexual coercer. So this is why going over these things and hearing what this means can help both parties. So if a person is persistently attempting to have sexual contact with someone after refusal, obviously, that's not okay. When a person makes another person feel they owe them sexual contact, so that might look like, oh, but I bought you dinner, or oh, we've been together so long, or I've been waiting all day for this, you already got me turned on, still not a reason that you need to have sex with that person. When a person gives excessive or insincere compliments to get another person to agree to sexual contact, so like, you're so sexy, I can control myself around you. I think you look so good naked. Like, cool, thanks. Like, fantastic. It does not mean that you owe that person anything. If a person's badgering, yelling, holding a person down, I hope we all know that would absolutely be sexual coercion bordering on sexual assault. If someone is giving or persistently encouraging the use of drugs, like, or alcohol, like we talked about, like buying you drinks, saying things like, let's liquor you up, like this person probably does not have good intentions. If someone is pressuring or threatening another person to agree to sexual contact because they're in a relationship, the whole like, if you love me, you would do this type thing. Like, if you're not ready, if you don't want to do that, that's not how you need to prove that to the other person. When someone reacts with sadness or anger, when someone says no, obviously, okay, that's on them. That's their feelings. You don't need to try and change that. When someone continues to pressure another, when you say no, or when someone claims they need it, like, and I'm going to use the stereotypical guy, like guys need it more. I've heard that in practice. I've heard male partners of patients tell me that, like, well, guys need it more than girls, or, oh, well, she gives me blue balls, and so she owes it to me. You don't owe anybody anything, and that sounds like a him problem, not a you problem. So this leads to hopefully nothing you ever have to experience, but sadly, you yourself may have, or someone you know may have experienced sexual assault. And it's important again to know what that is, what the definition of that is. So this is sexual conduct that happens without explicit consent of the victim. So this is when you've completely crossed all those lines. So this is attempted rape or actual rape, which is the penetration of a victim's body, fondling or unwanted sexual touching, forcing a victim to perform sexual acts on the perpetrator, forcing sodomy, which is anal or oral sex against a person's will, forcible object penetration, so putting something in a vagina or anus, causing a person to penetrate him or herself against their will, and also incest. And I feel like we throw a lot of words around all the time and people nod their heads, but I always feel like it's worth explaining what these things mean. So incest is having sexual relations with someone who you legally could not marry. So traditionally that would be a family member. There are some really great resources in the Lehigh Valley, which I'm going to go over in a second, but there's also really wonderful resources just in general online, or if there's just hotlines that you ever wanted to call, if you anonymously wanted to call, if you wanted to seek information, if you wanted to ask questions. A great one that we use as clinicians is RAIN, the Rape, Abuse, and Incest National Network, the Victim Connect Resource Center, and Joyful Heart. Also, I think a tricky spot to be in is when you are a friend, a family member, a loved one of someone who is sexually assaulted and you don't quite know what to do, but you want to be there for that person. There are some great resources online for how to support someone through this. The National Sexual Violence Resource Center and the PCAR guide has really specific information for those who want to help and support a family member who might be struggling with something like this. The Lehigh Valley, I have used a lot of these resources and had my patients check these places out, and they've had really great support systems in place. The Turning Point of the Lehigh Valley, Crime Victims Council. I put the National Domestic Violence Hotline on here because I don't know if any of you have been to like an annual exam. We have this plastered all over the inside of our offices. This is a great place to call if you're feeling unsafe If you have questions, if you just anonymously want to get some answers about things, and just kind of figure out where you stand, this is a great resource to have the information for. If you identify as part of the LGBTQ community, the Bradbury Sullivan Center is phenomenal and has amazing resources for you, for family members, or anything that you might need. All right. Any questions about the first part? That's like the really heavy stuff. It was a lot of talking, a lot of words. A lot of it's like self-explanatory, but it's always worth a review. All right, we're gonna dive into some STDs. This is like the bread and butter of what I do. And I feel like this is probably the trickiest, most questiony, that's the word I made up just now, part of what I do, because STDs are so sneaky and there's so much stigma around them, and there's just so many unanswered questions and a million myths that exist out there about STDs. So let's kind of dive into that. The first part I want to talk about is kind of like STDs and talking to your partner about it. And this is probably one of the most common questions that I'm asked. Do I have to tell someone if I have an STD? Like, do I have to tell someone that I was sexually active with, or that I plan to be sexually active with, that I have an STD? First of all, why would you not? If you care about the person, you should. I just want to say that up front. Ethically, yes, you should. And when I'm asked this question as a provider, I have to say, legally, no, you don't have to tell someone that you have an STD, but morally and ethically, you should. And just simple principles of empathy and like how you want to be treated by someone else, right? You would want someone to tell you they had an STD so you could take care of yourself. So I would hope that if you were okay having sexual relations with someone, you would owe them that respect of telling them that you did have an STD so they could receive the treatment they needed. I will say, even though you're not legally required, there is a difference between being obligated to tell somebody that you have something and recklessly spreading something that you know you have. So here's an example. If I had sex on, what's today, Monday, if I had sex on Saturday and I didn't know I had an STD, and I got a call this morning from my doctor and they're like, you tested positive for chlamydia. That wasn't recklessly spreading an STD on Saturday night. I didn't know I had it. Should I do the right thing and call that person and tell them? Absolutely. So that they can go get tested and treated and taken care of, and then they're not recklessly spreading it to somebody else. So the difference here is if I find out this morning from my doctor that I have chlamydia, and then on Wednesday I go have sex with someone else knowing I have chlamydia and I don't tell them, that is where the legal issues can come into play. So if that's what's defined as recklessly spreading. There have been lawsuits where people have gone to jail for not disclosing things like herpes and HIV to patients where they knew they had it and weren't disclosing and spreading it to others, because that can endanger one's health. So just don't even flirt with the idea. Just tell someone if you test positive, and we're going to go over some ways to go about that, because I know it can be an incredibly uncomfortable conversation. So how to talk about STDs is another really common question that I get, because it's uncomfortable, especially, well, I won't say especially, two scenarios. If you don't know the person well, really uncomfortable. If you know the person really well, really uncomfortable. So both scenarios are a really awkward conversation to have, but still need to occur. The best way to avoid ever having it is to talk about these things beforehand. So if you think you might become sexually active with someone, you can start the conversation by like, hey, like, why don't we go together? Because it's a scary thing to go get tested for STDs and, you know, walk into those testing centers and feel like maybe you're being judged, which first of all, you're not, but I know people can feel that way. Going together, like suggesting like, hey, why don't we go together? Just make sure we're both good before we start this. Talking to someone about like, I just got tested last month and like, I'm good. What about you? Like, what do you want to tell me when you got tested? When were your results? And then I feel like being open, honest, and transparent can let the other person be open, honest, and transparent with you. So being like, yeah, I got tested, I had chlamydia, and I got treated, and my test came back that I don't have it anymore. So that might let the other person feel like you're creating a safe space where they can be like, yeah, well, I haven't been tested recently, or like, oh yeah, I had that once too. Talking about these things lessens that stigma, lessens that awkward conversation, lessens the future conversation and the chance that you might have to have a future conversation that you don't want to have. So the next step is like, okay, cool. You go get tested. Then you get the call that you have something. How do you kind of go about this talk with your partner? So trying to stay calm, which I know is not easy because I have had to tell patients they have STDs and it is a wild ride. I get it. Your brain's going a million different directions. But remember, this is, at the end of the day, it's just a health issue that you're going to receive treatment for. And at risk of sounding like callous, it doesn't make you special. It's like, it's millions and millions of people, many of who are in relationships. They have the same diagnosis as you within the same year. This is common. This happens. It's a health issue like any other health issue. If you get a sinus infection and you're sick, you go to the doctor, you get treated, you move on. You don't try and spread it to other people, right? Same exact concept. Knowing your facts. So this is a big one. So there are so many myths about STDs that exist, and they have just continued to spread from generation to generation. It's amazing to me. Like, I don't know how toilet seats got so lucky that they got picked as like well, I don't think I got this from my partner. I think I got this from a toilet seat. I mean, toilet seats are gross, sure. But they're not just these like beacons of STDs shining up at you every time you sit on them. But I have heard that so many times. There is actually a website out there. It's like toiletseat.com or something. And I had a patient tell me like, oh, well, she found online that you could get the STD that I was telling her she had from a toilet seat, and she found it from toiletseat.com. And I'm like, I'm going to have you sit with that for a second. When you are looking these things up for yourself, because I know that's the first thing people do, they start looking for information, just make sure it's a trusted source. Make sure you're not on toiletseat.com when you're looking this up. Great resources. Like I said, Planned Parenthood has some awesome information that's really easy to understand and easy to read. The CDC is like the source of truth. It exists shortly in a little bit. Hopefully they keep that around. It has a wealth of information, but just make sure it's something legit, like you're on like the Mayo Clinic or the Cleveland Clinic or something along those lines. And be sure to have that information when you're sharing this with your partner, because they might look at you and share a myth about something, and you can say, actually, here's what I found. If you ever have a question, you can always reach out to your provider, because we are more than happy to help you with some of this information. Think about the timing. So try and find like a calm, quiet place where you're not going to be interrupted, where you can share this. Don't do it in a big, don't do it here. Like, don't do it right now. This is not a good space, right? There's lots of people around. This is maybe an embarrassing conversation that this person doesn't want to have. So respecting that person enough to share it in a way that they can ask questions and you can have a private conversation about it is important. And also think of your safety. If you are already not feeling safe in this relationship and you are doing the right thing by telling somebody that you tested positive for an STD, you don't always have to do it face-to-face if you don't think this is a safe spot for you. So whether it's a phone call, a text message, an email, something to let the person know, don't enter into a face-to-face conversation if you feel threatened by this person or feel like it could lead to an unsafe situation. And again, remember that National Domestic Violence Hotline if you ever think that you are in a situation like that. Questions about that part? Anything? All right, I'm gonna talk about STDs. This is the good stuff. All right, I picked the ones that I see most often, definitely the ones that patients have the most questions about. And then we're gonna end with the two that make everyone just infuriated and have like the most questions out because they're super sneaky and they have really unsatisfying answers for people. But they're probably the ones that I get the most questions about. So This is just going to be a brief overview. We're not going to dive deep on a lot of these, but again, if you have questions at the end, or I will share my email at the end too, if there's something you're not comfortable asking, you can always reach out to me. So HIV/AIDS, this is the big one. This is the scary one. This is the one that has the most stigma surrounding it. And this is the one that is definitely important that you get tested for regularly. So this is HIV is a virus that causes AIDS. We are in a place presently where there's such great medication available that HIV never has to turn into AIDS at this point. We have come a long way with HIV/AIDS treatment. So it's spread, most commonly spread sexually, carried in the semen, vaginal fluid, anal mucus, blood, and breast milk. Can also be transmitted from mom to baby in utero when she's carrying the baby, and can also, like I mentioned, spread through breast milk. So can enter the body through cuts or sores. Typically, though, it's through mucous membranes, which is like inside of the vagina, the rectum, opening of the penis. Can spread through vaginal or anal sex, can also spread through sharing needles. And that can include things like drugs, piercings, tattoos, especially equipment that hasn't been sterilized, getting stuck with the needle that has HIV, infected blood within it, or getting any type of like HIV infected fluid into an open cut or sore. All right, so let's talk a little bit more about that. So usually spread through unprotected sex. Condoms and dental dams can help. We're going to talk about that in a second. Not sharing needles, and using appropriate medication, which I'm going to touch on here in a second. It is not, so here's some of those fun myths. It is not spread through saliva, so your spit. You can't get it from kissing. You can't get it from sharing foods or drinks, using the same fork or spoon. Not spread through hugging, holding hands, coughing, sneezing. Definitely not a toilet seat. Cannot get it from a toilet seat. And that was like such a common myth in like the 80s and 90s. And for some reason in 2025, I still have patients asking me like, can I get HIV/AIDS from a toilet seat? You absolutely cannot get HIV or AIDS from a toilet seat. There is a wonderful medication now called PrEP. I prescribe it in my current job, and it can be useful for those who are in high-risk situations. So someone whose partner has HIV and you obviously want to have sexual relations with that person, you can take PrEP so that that does not transmit to you. Sex workers, they commonly use PrEP because they know they might be in situations where they're being exposed, or just anybody who wants to take steps proactively. If they might find themselves in a situation where they're exposed, they can go on PrEP. It's an amazing medication. There's also medications now that prevent HIV from spreading to AIDS. But should you not get tested, yes, this can be fatal. AIDS is when HIV kind of takes over and it progresses to more serious infections. You can get cancers, you can get tuberculosis, you can get pneumonias. This is something that can be completely preventable with regular testing. All right, chlamydia. So I put this in all caps for super common because I think I treat this like I don't even know how frequently a day I treat this. Spread again sexually through vaginal, anal, oral sex, carried in the semen, vaginal fluids, can affect the penis, vagina, cervix, anus, urethra, eyes, and throat. Yes, it can. It's rare, but it happens. Easily treated with antibiotics. Super easy one to treat. Like this sounds so terrible to say, but when you're freaking out about getting something, I'm always like, listen, this is a good one. Like, we're going to get it. We're going to treat it. You're going to move on with your life. This one's okay. Condoms and dental dams, again, help prevent the spread. Let's talk about that. So chlamydia is tough and it's rampant. Close to 3 million Americans get it every year, most commonly between the ages of 14 and 24. And the reason it's so rampant is because a lot of the time you don't have any symptoms at all. So you're walking around thinking you're totally fine while spreading chlamydia to other people. You may get some signs or symptoms, which is usually when people go get checked out. That could look like pain when you go to the bathroom, pain during sex, lower abdominal pain, vaginal discharge, discharge from the penis, swollen or tender testicles, or discharge or pain bleeding from the anus. So those are usually the patients that I'm seeing when I'm like doing the testing, but we catch this on routine screening all the time, all the time. And it's a really easy dose of antibiotics to treat. If you leave it untreated, it can lead to long-term irreversible effects. So that can look like pelvic inflammatory disease in those that have a uterus, fallopian tubes, and ovaries, and therefore can render you infertile. So you cannot have children. And the same can happen for men. It can lead to irreversible damage of their reproductive organs, and both parties who are infected and not treated can end up infertile. Next one's going to be gonorrhea, also super popular choice. Really hard to spell. I will say that I get a lot of people asking for testing for this, and I have no idea what they're trying to spell. So it's okay, as long as you're close, we'll figure it out. Again, most commonly seen in teens and 20s, spread the exact same way as chlamydia. You can prevent the spread with condoms and dental dams. Again, easily cured with antibiotics. All pretty much the same symptoms as you would expect to see with chlamydia to alert you something's going on, and you should probably get checked. But again, this one is rampant because a lot of times there are no symptoms at all. So getting regular routine screening is the only way some people catch this. The biggest difference between this one and chlamydia is that this one gonorrhea tends to produce more symptoms in the throat. So if you performed oral sex on someone who has gonorrhea, people come in with a sore throat, kind of like strep. Same idea, you get your throat swabbed just like you would for strep. If it's positive, you're treated the same way as you would be for any other gonorrhea. So please keep that in mind. Some people think they just have a cold or flu or, oh, I have a sore throat. If there's any chance that this could be something other than that, please come in and get tested. And again, same type of long-term effects where can lead to infertility if you do not receive treatment. All right, syphilis. So this one is kind of like old school, and screen for it every time, and you like screen for it at the start of every pregnancy, and we didn't really see much of this. And I feel like people, because of that, don't really know what to look for with syphilis because it's a totally different presentation than the other ones. But we are seeing a comeback, and I'm all about a comeback, but this is not a good comeback. We are seeing a resurgence of syphilis at rates they have not seen in a very long time. So knowing what you're looking for with syphilis is really important to know to go get checked. So the number one thing to kind of look for with syphilis is a chancre, which is a sore, usually on your genital area. And the way you know this is a funky sore is that it doesn't hurt. So if you have a sore anywhere on your body and you touch it, you're like, ow, that hurts. This doesn't hurt. And that is usually when people come in and they're just like, what is going on here? And we're like, okay, yep, definitely got to get that tested. If you don't get that tested, which first of all, that is how it's usually spreading, is when you have the chancre, that is usually how it's spreading from one person to another. In a few weeks' time, that sore will go away, and then you go into the second stage of syphilis. And I'm just gonna go to the next one. So the second stage of syphilis is usually when a funky rash on your soles of your feet and the palms of your hands show up. And again, it's funky because it doesn't itch. You get this like weird red rash and it shows up. And then you might get some flu-like symptoms like some swollen glands. You might not feel good, like you feel like you're run down. And again, people chalk this up to like, I don't know what that rash was, but I think I just have the flu. I think I just have a virus. I think I just have something, and they don't go get checked. The problem is then it can go to the late stage of syphilis, which super sneaky because this infection can lie dormant in your body for a really long time. And then months, years later, shows up as late stage syphilis, also called tertiary syphilis. And that's when it can start affecting like your nervous system, can cause tumors, can cause blindness, paralysis, and can lead to death. Again, this is something so easily treated if you know what you're looking for. This is just a shot of penicillin. Like it's a one-time dose of penicillin to treat. But if you don't know what you're working with, you don't know what you're looking for, you don't get tested, this can easily be missed. All right, trichomonas. This is another really popular one. So for females, this one's tough because we sometimes get vaginal infections that look like yeast infections, bacterial vaginosis. Bacterial vaginosis presents very similarly to trichomonas. So people think like, oh, I just have another episode of BV, as it's commonly called. Maybe, or maybe it's trichomonas. So they both, unfortunately, present with a very foul, fishy odor, and it's hard to tell the difference between the two. So anytime someone comes in with BV, we always recommend getting the testing for trick, just to make sure. Because if you have trick and you don't get tested, then you have no idea that you're spreading it, and or your partner needs to be tested so that you're not getting it back again and just playing that really fun game of giving it back and forth to each other. So patients who decline testing and just keep coming in with BV, we're like, yeah, we definitely gotta check this thing out. Again, antibiotics, boom, out the door, done and done. Okay, so these are the ones that are just like throw you for a loop. I encourage you to stop me during this if you have questions about, and we're gonna go over herpes and HPV, and they're a lot to process. So like, if you are just like, wait, what do you mean by that? Or like, what, if you have questions, just raise your hand. I'm happy to do it because it's like a lot to digest at one time. So this is a virus. So this is not something you can cure. This isn't, an antibiotic isn't gonna take care of this. It's not gonna like show up, you treat it and it goes away. This is something that lives in your body your entire life. Once you're exposed, it is with you. And that is why so many people have both herpes and HPV. So it typically, the way you know you have it is because you get sores, either on your mouth, which are commonly called cold sores, or in your genital area. Previously, they thought that, so HSV1, you might have seen these in commercials, HSV1 was cold sores and HSV2 was genital sores. So they're interchangeable, it doesn't matter. If you ever have a sore and they swab you, it'll come back and say, to HSV1 positive. Well, that might be on a genital sore, because if someone performed oral sex on you and had HSV1, then that's where it's going to present. So they're interchangeable, it doesn't matter. That's like an old terminology that one is oral and two is genital. It's spread from skin to skin contact with infected areas, most commonly during sex, but it doesn't need to be. And we're going to talk about that and why it's so sneaky. So usually you'll get like the itchy, painful blisters, the sores that come and go, oftentimes mistaken for something else. So then the kiss of, I don't want to say kiss of death because it's a terrible way to say it, but among the OBGYN community, we always knew someone had herpes when they would come in and say, I seem like I cut myself shaving and it's not getting better. Every time it was, I cut myself shaving and I still have these sores a few days later, we're like, I don't even need to look. I know what this is. It was like 99% of the time it was herpes. So they don't always look exactly like this picture either. And it's this painful, burning, stinging sensation that can feel like maybe you cut yourself shaving. But going and getting that tested, if it's not healing, if it's not getting better, or if it feels like it came back, like you had that before, definitely go get checked. Like I said, there's no cure for herpes, but there are medications to help with the symptoms and to help help prevent transmitting that to other people. All right, so herpes is most contagious when you have the sores. So I would hope, if any of you are looking at progressing in any type of sexual act with someone who has an active herpes sore anywhere in their body, you have enough wherewithal to be like, and we're gonna stop. Because that is the best way to avoid getting herpes from somebody else. The sneaky part comes in, however, and it is no fault of anybody's, is that you can spread this without ever having an outbreak. So you may have been exposed to herpes by someone who didn't know they had herpes and gave you herpes, because your body, this is how viruses work inside the body, the virus goes through shedding processes here and there where they're like replicating the virus inside your body, and it's like finding new host cells inside the body, and it's a whole thing going on in there. And while that process is happening, you, without any outward symptoms, can transmit the virus from skin to skin contact with somebody. And that's why this virus is rampant and everywhere. And you many times unknowingly spread this to someone else. If you know you have herpes, that's a different story. You should disclose that to someone that you are planning to be intimate with. But many times this is spread unknowingly. And that's a really hard pill to swallow when you're telling someone that they have a virus that they're never going to get rid of, that might pop up here and there throughout their life from time to time, and you have no idea when or where or how or why. And people want to know who gave it to them, how they got it, when they contracted it, who they, and the problem is you probably, unless you have only had one sexual partner in your whole life, probably aren't going to get the answer to that. The other caveat to that is sometimes parents pass it to children when they're little because they have cold sores, and they're probably not kissing their child with a cold sore, but if their body was going through that viral shedding process and they did kiss a child or kiss somebody else that, you know, was important to them, they could spread it that way too. So this is why this one is so sneaky. And HPV works in much the same way. Now, like I mentioned, there are medications like Valtrex and acyclovir and things like that that you can take at the onset of an outbreak, and that can help lessen the symptoms and shorten the duration that you have the outbreak, and it can help reduce the risk of transferring it to other people, but it doesn't completely take it away. All right, so which leads to HPV. So this is a concern. I think many times it's thought this is a concern for just women, but this is women and men, because it can cause, yes, cervical cancer. It's what causes cervical cancer, but it can cause different type of head and neck cancers. If you are performing oral sex on someone who has HPV, it can cause cancer in the throat. It can cause anal cancer. So this is not just women. This is the most common sexually transmitted infection. Most go away by themselves. Most of the infections clear on their own, and you never, like, you might have an abnormal pap smear at one point in your life or never know you have HPV at all, and then your future pap smears are all beautiful and normal and fine, and your body has cleared the virus, and that's awesome. But many times it is not the case, and there's two different ways it can express itself. You can get genital warts, which just look like your regular genital, they're like flesh-colored little genital warts. I have a picture on the next slide. Or it can present as cancer, because there's different strains of HPV. Some cause warts, some cause cancer. Most sexually active people have HPV at some point in their life. We will never know the exact number because of what I had talked about with people's bodies clearing it on their own without ever knowing that they had it. So there are two types of HPV that typically cause genital warts, and those are types 6 and 11. And they look like that little picture there, like little flat warts. You can get them removed in an office setting. There are topical treatments you can put on to help remove them a little bit faster. Again, if you have an outbreak of genital warts, you should not be having sexual contact with anybody to help prevent the spread. There are at least a dozen types of HPV that can sometimes lead to cancer. Two that are common for the most cervical cancers that we see on pap smears, which are 16 and 18. Like I said, there's no cure, but the vaccine is amazing in what it has done for reducing the numbers that we've seen of cervical cancer over the past few years. It specifically targets, the vaccine targets the types 6 and 11 that cause the warts, and 16 and 18 that cause cervical cancer. So it has done wonders as far as cancer is concerned. It's incredible. Condoms and dental dams, again, for herpes, for HPV, yes, still encourage you to use it, but because these things can be spread from just skin to skin, they can't fully prevent transmission. Questions about any of those? Looks like a lot. No? All right. So I just wanted to conclude with a couple of options that you have, both for contraception and STD and STI prevention. So I also want to say STDs is kind of like the outdated term, like sexually transmitted diseases. It's pretty much referred to as STIs now, sexually transmitted infections, because they're not really all diseases, they're infections. This is kind of going over some contraception options from the most effective to least effective, because I feel like that's a really common question I get is like, how effective is this? Well, there are certain things that are incredibly effective. So sterilization is always going to be the most common one. For women, that looks like getting what's called like getting your tubes tied or your tubes cut, your fallopian tube, so you literally cannot get pregnant. For men, that looks like a vasectomy. There's also, they're called long-acting reversible contraception options, which is an IUD and an implant. The IUD goes inside the uterus, the implant goes inside your arm, and they're both good for multiple years, which is why they're pretty great. Then you have less effective only because of user error. Anytime their contraception method needs to rely on the user to be perfect, there's going to be some room for error. For those of us that have used contraception, it happens, it's okay. But that's why they're just a little bit less effective. And that can look like the birth control shot, commonly called Depo, the birth control pill, patch, the ring, and the diaphragm. So as you can see, the diaphragm has a much higher failure rate as compared to the others. And then the least effective is in terms of contraception, we're going to talk about STD prevention here, prevention here in a second, would be male condoms, female condoms, the withdrawal method, many times called the pull-out method, contraceptive sponge, fertility-based awareness, which is also called natural family planning. So like timing intercourse around when you think you're ovulating each month, and spermicide. So I just liked this because it's kind of like all-encompassing and a really great way to think about STI prevention. So using barrier methods, condoms, dental dams, finger cots. I will tell you what a finger cot is. I don't know of any patient I've ever had that have used one, but they're like little condoms for your fingers that if you're concerned, like you have an open sore on your finger or something, you could use that if you were planning on having any type of penetration with fingers during sexual activity. Water-based and silicone lubricant. They do not break down the condom or the diaphragm. So that's really important. That's basically all that's sold in stores, but just double checking and making sure that is what you're using when having sex with a condom. Washing your sex toys, keeping communication open, talking about the consent we talked about earlier, limiting sexual partners, obviously more partners, higher risk of STIs, and regular testing for you and your partner. So we have some quick videos that can demonstrate how exactly the proper way is to use some of these items we just talked about. Because I don't know if you're like me, I'm a visual learner. I have to see these things to actually understand how to use them. So the first one is going to be the internal female condom.
Internal condoms, also known as female condoms, go inside your vagina or anus and are used during sex. Like other condoms, they help prevent STDs and pregnancy. Internal condoms are easy to use. For vaginal sex, squeeze the sides of the inner ring at the closed end of the condom and slide it deep into your vagina. For anal sex, remove the inner ring and insert the condom into your anus with your finger. Leave the open end of the condom outside of your body. During sex, make sure the penis or sex toy goes into the condom and doesn't slip outside of the condom, or push the open end of the condom all the way inside you. Internal condoms are one-time use only, so use a new one every time you have sex. Internal condoms work great with other birth control methods, like the pill or IUD, for extra pregnancy preventing power. And unlike other types of birth control, internal condoms also help protect you from STDs. Internal condoms can be harder to get than traditional condoms. You can get them online at many Planned Parenthood health centers, other family planning and health clinics, and in drugstores with a prescription from your nurse or doctor. Want to learn more about internal condoms? Check out PlannedParenthood.org.
Okay, so that's the internal female condom. Probably not something that you hear about much, but certainly exists. Certainly, I have patients ask me about it because sometimes they don't want to rely on a male partner to show up with a condom. So they want to be prepared themselves. They are up to 95% effective in terms of STI prevention. The next one's going to be a dental dam. And I actually added this because at my last talk I had at Northampton Community College, a student asked me about dental dams and I was like, that's such a good question. And I don't think they're used frequently, but it is a great way to prevent spread of STDs, STIs when performing oral sex. Oh, you can make them yourself.
Dental dams are a barrier method that can be used for oral sex on a vagina or anus to protect against STIs. While you can buy dental dams in a store, you can also make one in a pinch out of an external condom. Remember that animal skin condoms will not protect against STIs. So for a dental dam, be sure to use a plastic or latex condom. First, you want to check to make sure that the condom's packaging is intact. Look for any liquid or tears on the outside of the package. Afterwards, open the packaging with your hands and roll the condom all the way out. After it is rolled out, use a pair of clean scissors to cut the tip and the bottom off the condom. Then, cut down one side of the condom to open it up. Be careful not to pierce the condom while you do this. You should have a rectangle that can then be placed against the vagina or anus and used for oral sex. When using a dental dam, be sure not to pull the dental dam too taut, otherwise it could break. It's also important to remember which side of the dental dam is placed against the anus or vagina. When in doubt, make or use a new dental dam to continue protecting against STIs. Thanks for watching. Be sure to check out UChicago Student Wellness or talk to an in-touch peer health advocate if you have any further.
All right, questions about dental dams, because sometimes that's like people's first introduction to what that is. Oh, you have some in the back. Awesome. You can purchase dental dams, like specifically for that, but most often people have a condom at home or can access a condom easier. So that's a great way to have one probably more readily available. And then the last one would be how to use a condom correctly.
Our full condom counseling guide. If you liked this video, you will love our textbook, The Geeky Medics Clinical A Condom in 60 Seconds. First, check the packaging, the expiry date, and the kite mark. Open the packaging by tearing with your fingers, not your teeth. Be careful with nails and jewelry. Check that the condom is the right way up. The condom should be applied to an erect penis. If the penis is uncircumcised, pull back the foreskin first. Pinch the tip of the condom, place on the head of the penis, and unroll all the way to the base. A good fit is a snug fit. If you accidentally try to put the condom on upside down, throw it away and try again. Water and silicone-based lubricants can be used, but oil-based lubricants can damage latex condoms. When withdrawing the penis, grip at the base. Remove the condom carefully and discard in a bin. If the condom breaks or comes off, there's a risk of pregnancy and STI transmission. Consider emergency contraception and an STI screen. Make sure to subscribe to Geeky Medics and check out our full condom counseling guide. If you liked this video, you will love our textbook. The Geeky Medics Clinical Examination Guide summarizes all the key.
Any questions about that? All right, my last little plug here. Oh, quick question. True or false? Best place to carry condoms in your wallet? Definitely false. Definitely false. So first of all, how long has it been in there? Secondly, what's it been exposed to, like temperature extremes? They do start to break down over time. So do not carry it in your condom room temperature, store it, or do not carry it in your condom. Do not carry it in your wallet. And if you see someone pull one out of their wallet and you are planning to have sex with that person, I would hold off because you have no idea how long that thing's been in there, if it's, you know, expired, if it's even still good to use. So something to keep in mind. And then because they did mention this in the video, I thought I'd just throw it in there. not, yep, there it is. So their emergency contraception is available to you. I don't know what future legislation will look like with this. This is something I prescribe daily. We have no idea where this is headed in the United States, but for now, you can get emergency contraception. Plan B is available over the counter. You can walk into any pharmacy and get Plan B. Ella is an emergency contraceptive pill that can be taken up to 5 days after unprotected sex. That needs a prescription from a healthcare provider. Plan B is good for 3 days after you have unprotected sex. The most effective form of emergency contraception is the insertion of a copper IUD. That can be done in a provider's office. And that is the end of my presentation. Do you have any questions? Yeah. Yeah. That is extremely true. Not true for everyone. So the idea around IUDs and pain control is changing because women are finding more of a voice with this and saying, I'm not going to stand for this. So it literally, like I used to say, like we would bring women in and be like, okay, bite down on this stick. I'm going to put, I mean, that's not what we did, but that's kind of the pain control we offered. More insurance companies are covering patients going under anesthesia to get it put in, or numbing agents called paracervical blocks, which you can numb the cervix to have it inserted, so it's much more comfortable. But yes, it's very uncomfortable for those who've never had a child. So nothing's ever come through that cervix before, so it's very painful. Or there's many patients who have had children who it's just incredibly painful. What an IUD essentially does when we put it in is your body thinks it's contracting and it's in labor. So you're just in labor with no good drugs, which a lot of women get the good drugs when they're in labor. So we're just like, oh, okay, enjoy, here's an IUD. But there hopefully will be a lot more pain control options going forward. That's a great question. Yeah, of course. We do have bananas and condoms available. If you would like to try and roll a condom on a banana, you are more than welcome. I will be back there to help with any questions. And feel free to take a condom, coffee, chocolate, water, cookies. Oh my gosh, cookies. Come on. You can't say no to that. And any questions, please let me know. Thank you.
Hiya.